Sustanon 250 response video. Thank you so much. This video we did on Sustanon 250 was outstandingly successful, and I knew it. I just knew it was going to go well. This is so important. It's TRT. It's so important for men that are on testosterone replacement, every man in the world that's on TRT, all the way through to bodybuilders and people that are using this for building muscle and for strength. Amazing how much we all learn from you and from the comments. This is open, and that's why YouTube is great for this kind of stuff. People get to really see, and they read from people and men. There's never going to be one answer in this stuff, so you have to see how it fits for you. Right off the bat, the comments that go back and forth in the estrogen. So someone talks about, in his opinion, it's the worst for TRT. Most guys are TRT actually like enanthate and cypionate versus Sustanon 250. Some of the responses say that they agree. This is from the UK. So again, we see guys in the UK and Australia on here because this, again, is what their doctors are prescribing. It's, in his opinion, it's terrible to control estradiol when even microdosing on every day or every other day. Experiences here in the UK, majority of lads I know pretty much have favorable experience with enanthate. So there's a shout out for enanthate. Interesting, it's been marketed, someone said, in the boardroom versus the lab. And that's amazing. You know, someone brought this up, the marketability of where this comes from back in the day. The idea of being that the esters kicked in ascending order from shortest to longest, when in actual practice the pharmacokinetics show anything but that with the blood markers when they're monitored. That's amazing because that's the theory. You have 4 esters and you have very short acting, medium acting, and then a little longer acting. So in theory, if you just took one shot, it's going to kick in like that. But when you start to take multiple shots, after the half-lives kick in and you have a steady state pharmacodynamically, you guys are amazing that you understand. These must be pharmacology guys too. So when that steady state kicks in, what happens? This is the stuff that there's no science on. This is just kind of art, and it's different men's genetics with enzymes in their brains and so many other variables, what their weight is, their enzymes, other medicines, psychiatric disease, depression, are they young, are they old, so many other things to be considered. I just love this. But in theory, when you look at it, this is such a great topic to bring up. It's very terrible. Someone says unstable blood levels from Sustanon 250 cannot be attenuated through microdosing. And that's amazing because microdosing really theoretically is going to work great when you use something that an ester that's very predictable. This is not predictable, but let's keep moving. Someone says here Sustanon 250 is only good for someone that can feel good with having elevated estradiol levels. That's amazing to me because so many times I'll have a man come in after he started on TRT for 6 weeks or more, even maybe into a year, and I'll say, how do you feel? And you say, I feel great, doc. Sex drive is off the chart and I feel great. And then you look at the estrogen levels and they're high. So there's such a disconnect between the actual numbers on paper and the man himself. Again, we're getting at so many different variabilities, so much aspects, and every man's brain's different, the enzymes are different, every man has a fingerprint. We have to understand that. So there are men that feel good with having super physiologic estrogen levels. I mean, you can't take estrogen completely out and just balancing it on paper and treating that piece of paper that I say with microdosing itself and aromatase inhibitors, it doesn't always work out. Definitely true. Sustanon once a week anecdotally leads to horrible acne and gyno due to the fluctuations of the short esters at 250 milligrams a week. Anything less than twice a week is unstable by most It's horrible, horrible ester blend. The injection post-pain is something that's talked about here, and that's definitely from the short-acting propionate and the phenylpropionate. No question about that. Well, you inject that, and you're going to feel that. But not all men experience it. It depends where you inject, how often. Here's a guy, hated it. I liked the size it gave me, but I couldn't walk for 6 to 8 days after the injection, all the time after every shot. This was way back. We didn't know what was going on. Every 10 days, 250. No wonder the roller coaster and the bloating. Fast forward to now, in my 40s, prescribed Cypionate, look extremely vascular and dry. He's on 100 milligrams a week. Not as big as I used to be 23 years ago, but he feels better. This is amazing to me. Propionate is talking to you. Someone said the propionate's talking to you because there's the pain. You know, way back years and years ago, I didn't know any of this. I've learned this all from my patients. So more comments talking about that this is the ester that you will get in Europe and the UK. So that's amazing. And they're amazed. Guys are amazed that we can't get it here in America. So we're all learning about this together. Next, negative comments regarding Sustanon 250. Post-injection pain is horrendous and it hurts real bad. Well, we talked about that. That's definitely the short-acting ester that's in there. The ups and downs are just not good with the short-acting esters with Sustanon. This gentleman talks about that he would prefer a nanthate for microdosing, but he's in Europe and the insurance and the system is paying for Sustanon 250. The problem is generally prescribed once every 2 weeks or 3 weeks, and that's not optimal. And that he asked his doctor that he could split it up to have more microdosing, probably even just once a week. And he says his doctor wasn't going to do that, didn't feel comfortable with that. That's too bad. I wouldn't understand why that would cause a doctor to feel uncomfortable. You know, every doctor is going to be different. You have to understand that, and doctors will feel comfortable with certain regimens that they use. You know, we're doctors. There's liability out there in every country and being a physician. So we're here to heal. So when you learn something, this is really something I want you guys to understand. When a doctor treats a head cold, which they shouldn't be with antibiotics, right? But if they treat anything, blood pressure, TRT, doctors, including me, you're going to have your wheelhouse. You're going to have your regimen you feel comfortable with. And doctors made just like the cream because it seems softer to the doctor. That's definitely not the right thing and the right way to do it. But they're going to feel it's softer, and they're going to feel that's for you, sir. This is how I do it. If you don't like that, you know, I guess you can go somewhere else, or I'm just not going to do that. And it's too bad when it's your primary care doctor. So that's why I'm working on these things. We need to give doctors the understanding that every man is different, and when it comes to TRT, it's not going to be just one exact type of regimen for every man. Look how incredible this is. Who would believe this one video on just one medicine, Sustanon 250, would blow up so big? And the doctors read this. It's incredible, the variability. But of course we know that because it's fingerprint medicine. Every single man is different, and you have to take that into account when you're prescribing, certainly testosterone therapy. Again, that seems the worst side effect here is the post-injection pain. And then here's another guy who really says he doesn't like it, needs to be injected every day to avoid elevated estrogen. We don't know. Here's another man, feels poorly. He says he feels much better on Cypionate or Nanthate. Been on Sustanon 250 for 3 years in Australia. 1 injection every 3 weeks, felt nothing and still unwell. Doc had me on same amount, but now every 2 weeks. Had all my blood work done and still low. Testosterone low, sex drive is now gone. I asked for weekly injections to get my numbers up. I was told by the doc that it can't be done in Australia. That's interesting. They're giving a medicine, but they won't budge on how it should be. The interval should be given like microdosing. I just don't. Again, doctors, we have to work with these doctors. Doctors, please consider changing the dosing regimen. It's not illegal. It's unethical not to listen to the patient. I just don't understand it. Again, they're going to feel a certain way, and that doctor is not comfortable with changing that. So this man feels horrible. Seems like this man feels worse when he's been given testosterone. And I do see that, Men will come in, they have low T, they get treated. The doctor takes the consideration to treat them with a gel, with injections, pellets, whatever it is. And then the guy looks worse because he goes to the lab after injecting every 2 or 3 weeks, and then he's actually lowered the testosterone because the pituitary is now shut off, and the ester is out by the time he goes to the lab, and therefore it's low. This is definitely something I see frequently. And doc, how can I be treated for testosterone and you just crash my numbers? It's because of the dynamics of the ester. They're not dosing it on the interval that's appropriate. So much variability. Again, these are so simple. It's just so simple. Get that variability right. No one wants to be a pincushion. I certainly don't like that. But you want to get the variability so it doesn't go like this and the ester goes like that. And the man's brain feels great. Here are the positive comments. Sustanon is the only test I'll do. I took it 6 weeks to feel sip and enanthate. Sustanon was immediately immensely better. Interesting. Been on Sustanon 250 for about a year, 1 ml a week. Can tell you from firsthand experience, this is by far the best TRT option out there. That's from a guy named Jim Head. On TRT, Sustanon 250 week, I feel better when I'm on Sustanon. I did Sus for 3 years, switched to Cypionate for about a year, and he's going to go right back. He splits it Sundays and Wednesdays. Prescribed Sustanon 250, 125 milligrams every 5 days. This is a very common dose, by the way. Half a mil Sustanon 250 every 5 days. Slight post-injection pain compared to enanthate. Only drawback for him, but he still prefers Sustanon 250 to his single esters. There it is. This nails it right here. He's not using it specifically for bodybuilding, so he's using it for wellness, just to feel well. Really enjoy learning, doc. Thank you. Here we are back in the UK. Sustanon, I feel the peaks and troughs are less harsh and less frequent. It's a shame you can't prescribe in the US. This is in contrast to the initial questions where men were saying there's great peaks and troughs and crashing. So you could see this is an art to this. It's going to be man per man. Here's a guy who says, I felt overall healthier, cleaner on Sustanon than any other ester. Here's a guy, I never felt as good with testosterone enanthate as with Sustanon 250. Big difference. You can actually feel the effect the next couple of days. Testosterone enanthate takes more time. It's not worth it. He took it for 4 months and he felt poorly on it. His dose looks like to be, again, it's that half a mil Sustanon 250, and he's doing it probably every 5 days, 3 to 5 days. Seems to be what the average is going on here. Last question is about microdosing, and that's very straightforward, microdosing. Some guys are suitable to saying it every day or every other day. That's really microdosing. And I think that, it's too much. I mean, who's going to be doing this every day? I'm amazed at you guys and my patients that really want to break it down and do it every day, every other day. Tiny doses. I mean, you got to use a 1 mil pin, and you got to use a needle that 25, 27 gauge, but even I heard guys 29. Boy, it has to be so warm, and it takes so much time to inject that. But again, these men are particular, and they like to do that. But most commonly, it's a half a mil. It's just like Cypionate or enanthate because it's 200 versus 250. The total ester number is very similar. But again, the amazing piece is that the breakdown, this amazing milieu of esters does something to men's central nervous systems, and they just feel this sense of wellness and this bubbly, high, kind of a low grade but sustainable, and the libidos can be outrageously well. I mean, this is just my anecdotal take home from that. Muscle building, the muscle, I mean, it's hard to say, enanthate, cypionate, esters in the end. You could see that difference with the total and the free ester on any ester, cypionate, enanthate, propionate, this blend right here. But in the end, the sustainability and the overall wellness and that euphoric effect is something that we're looking to give to men that are on testosterone, yet using any ester or any means possible. So I conclude this video. Thank you so much. Let's get even more comments going on this, because I want the world to really know, what about these esters, all the esters on testosterone? Even try to compare these to the pellets. Maybe we can see comparisons versus the pellets, and the transdermal gels will be really interesting to get your opinions and your comments and experiences on that. And the closing note for the healthcare providers is that doctors have to feel comfortable with what they're prescribing. They have to have a methodology in that. You have to respect them for that, men, please. But in the end, doctors, you need to have options for men. No man is going to be the same. So you have all these options. Consider the options and be open to the options. And microdosing, be open to microdosing. It's not illegal, apart from a man taking more injections where he could be feeling more pain, it appears. And with more injections, you're prone to more infections because you're pinning yourself and breaking your skin more frequently. So statistically, you're at risk for infection. So all men have to figure it out for themselves with their caregiver, and that's why I'm here to bring testosterone therapy to a place where every man can be cared for properly across the board, and that is testosteronology.